I'm here with Dr. Robert Roda, the Vice President of the American Association of Endodontists, and we're going to be talking about Root Canal Awareness Week. Dr. Roda, why was Root Canal Awareness Week started?
Root Canal Awareness Week was sponsored by the AAE due to a lot of historic misperceptions about root canals. The President of the United States in a State of the Union address in 2010 said that he knew that bank bailouts weren't very popular. They were about as popular as a root canal. And we hear statements like this all the time from people in our lives all the way up to the President of the United States. And we want to dispel these rumors because it's misinformation, and with good information, we believe that people will not have the kinds of societal fears that they get. In fact, we just completed a survey at the AAE, and 70% of the consumers, the Americans that responded to the survey, said that they really kind of wanted to avoid getting a root canal. On the other hand, about 74% said that they really wanted to avoid having an extraction. So we just need to sort of match the expectations with the reality.
Okay. And we often hear about the relationship between the general dentist and the specialist. What are some tips you have to encourage a successful relationship between those two?
The general dentist and the specialist are partners. I was a general dentist for 10 years before I went back to graduate school and became an endodontist. And my endodontists were my partners in patient care. They were my friends. They helped me out when I needed to, and when I needed them with information, help, and especially patient treatment, because endodontics is one of these disciplines that is very difficult to tell right up front sometimes how challenging a case is going to be, sometimes till you get right into it. And so it's always nice to have an endodontist that you can call and ask for any kind of help. But the main thing is that that general dentists provide the level of care necessary for sort of, I hate to use the word routine because there's no such thing as routine treatment, but endodontics tends to be pretty complex. And so what the endodontists provide to the general dentist is a service whereby the general dentist can refer a patient over to the endodontist to have the root canal therapy completed in an expeditious manner. And again, our surveys show that upwards of 90% of patients that are sent to endodontists are extremely satisfied with the work that they get done there.
And our final question for today is, what is the biggest challenge that's facing endodontics and endodontist specialists today?
I think probably the biggest challenge that we see is right now is busyness. It's caused by the economy largely, and what we see is that as the economy went down, that the busyness of dentists and consequently the specialists, including endodontists, has gone down. Probably about 50% of our members in our latest survey on that showed that that they really are seeing referral patterns being flat, and our survey of generalists shows that the referral patterns haven't really changed very much between our survey in 2009 and our survey in 2012. On the other hand, what is just constant is how well general dentists feel about their endodontists. They really do consider us to be their partners. And so while our challenges tend to be short-term related to economic factors, one of our greatest strengths is our relationship with the general dentists. And also, not only are there challenges, but there are opportunities. The science of the clinical science of endodontics is just going crazy. New advances like cone beam CT imaging, small field of view, high resolution for endodontic treatment has allowed us to see things that we've never seen before. New methods of instrumentation, new methods of irrigation. The science marches on, and it really is just an amazing opportunity for us to move forward.
Well, thank you. Thank you for joining us today. I know that Root Canal Awareness Week begins today, so we appreciate you joining us in this busy week for the AAE.
Well, thank you very much. It's been a pleasure.